Most of our labels for people tend to be global: genius, homosexual, giant. Such labels tend to influence every other judgment of, or reaction to, the person who bear them. I first came to notice this effect when I was doing my training in the psychology department in college. When people walked in the door of the clinic, they labeled themselves patients, and at the time I saw them this way as well. When we discussed certain behaviors or feelings that they saw as a problem, I saw their behavior as consistent with the label of patient. Later, outside of the therapy context, when I encountered exactly the same behavior or feelings in people whom I know, it appeared to be perfectly common or to make sense given the circumstances. To test the impact of labels, psychologist Robert Abelson and I designed an experiment using a videotape of a rather ordinary-looking man being interviewed. He and the interviewer sat in armchairs facing each other and talked about work. We showed this videotape to psychotherapists. For half of the therapists, we called the man being interviewed a job applicant. For the remaining half, we called him a patient. The therapists to whom we showed the tape were of two different backgrounds. Half had been trained in various traditional ways. The training of the other half had specifically emphasized the avoidance of labels. We found that when we called the man on the tape a job applicant, he was perceived by both groups of therapists to be well-adjusted. When he was labeled a patient, therapists trained to avoid the use of labels still saw him as well-adjusted. Many of the other therapists, on the other hand, saw him as having serious psychological problems. Because most of us grow up and spend our time with people like ourselves, we tend to assume that others share the same features as ours. When confronted with someone who is clearly different in one specific way, we drop that assumption and instead look for more differences. Often these perceived differences have no logical relation to the observable differences. For instance, because of the unusual gestures of a person with cerebral palsy, we might assume a difference in intelligence. Such faulty assumptions tend to overstate the perceived gap between people who are normal and those who are different. This sometimes leads to the formation of prejudices against certain groups of people.